So we're gonna start by just unwrapping the ACE wrap first. After surgery, you'll be home with an ACE wrap, and then there'll be a layer of gauze underneath this. I'm gonna gently lift the leg here, and we'll work on unwrapping this. And we can set that aside, and then we'll slowly work on unwrapping the gauze layer. And we won't be needing this gauze after the bandage change, so we can just set all that aside. And so this final layer will have the gauze that's covering your incisions. Once we unwrap that, you're gonna see some yellow dressings that are gonna be directly over the suture site. These will be coming off here and removed. Not uncommon to see a little bit of blood or drainage on that gauze after surgery, and that's okay. Now we're just gonna clean the area around the suture site. We can use gauze with some alcohol or a warm washcloth with some gentle soap and water, okay? The important thing is that we're just cleaning the area around the sutures. Our patients may notice an orange tint to their skin. That's the preoperative surgical soap. That'll come off with a couple showers. Now, there are 3 steps to the dressing change. The first step is going to be the zero form layer. This is a non-stick medicated bandage. So this bandage is gonna promote a moist wound environment. It's not gonna stick to these incisions, and it's gonna help heal everything. Comes in a long strip. We're just gonna cut this strip into smaller pieces and place one piece directly over the incision area. Doesn't have to be perfect, just has to be enough to cover the site. So just a thin layer, gently press that down. That is step 1. Step 2, we're just gonna take some gauze and we'll be cutting that into smaller pieces to fit over those suture areas. Just big enough to cover the area. And so the gauze will help absorb any drainage that might occur over the next 24 hours. This patient didn't have much drainage, so things are looking pretty good. So the final step is gonna be Tegaderm. This is a clear, sticky bandage. It's gonna be placed directly over the area to create a nice waterproof seal. So we're gonna peel the back off, place the sticky side directly over the gauze area, gently press that down, and then we'll peel the tabs back and reinforce the edges. Again, this will create a nice waterproof seal over those incisions and help keep everything clean, dry, and protected. Again, just press down gently and peel the tabs back, reinforcing those edges. Now, as long as everything is clean, dry, and covered, you can go a couple days before needing to change your dressings. You can shower with these dressings in place. Running water, gentle soap is fine. No soaking or submerging the knee underwater until we see you back for post-op. If you happen to build condensation under the bandages, go ahead and remove those, let everything air dry, and then reapply as needed, okay? And we'll do an ACE wrap for comfort at the end. Gentle compression, nothing too aggressive.